Here we go with some exciting topics to discuss today. How are you, sir?
I'm just living the dream up here in northern New England. Good times up here in Maine.
Exactly. And soon you're going to be overseas broadcasting live, right?
I'm flying over the pond. I'm going to Scotland.
That's got to be cool. And I'm heading to Columbus next week for my trip. I'll be at an Airbnb for a week as I'm going to the VFW convention with one of my clients next Saturday. I'll be in Columbus from Friday to Friday next week. All right. So our topic.
Sorry to hear that. Why do you go to Cincinnati? You get your ass kicked up.
Entrepreneur savings. I'm a Pittsburgh guy, so Cincinnati, Columbus, Cleveland. Come on now.
Yeah, you can't go to Cincinnati. You get beat up downtown.
Yeah. Oh, okay.
Yeah, get roughed up. People film instead of help you.
So our topic today: Solopreneur savings, mastering health insurance with ClaimLinx. What exactly is ClaimLinx Concierge Service, and how does it specifically benefit solopreneurs and self-employed individuals?
What we're doing is we're helping individual people navigate through the healthcare system because they don't understand it. And there's two components: how to buy the insurance, and then the second component is how to fund your out-of-pocket tax-free. And most people are unaware of how to do either. And most people are out there buying gold or silver plans, and we're showing them, hey, you're on this drug, use this manufacturer's rebate, pays for your whole deductible. Rest of the year, you have a 100% health plan and you pay half the cost. How to take advantage of subsidies. If you're retiring, how to use your Roth IRAs, blend it in before you're 65, so you get your health insurance at virtually no cost. All kinds of little nuances we do.
And one thing, working with some of these solopreneurs, gig economy people, they don't have health insurance. They're rolling the dice, or they're going to the Affordable Care Act and they don't understand when they go shop there. It's complex. It's not easy. And you showed me something for me to save as a small business. And I'm like, excuse me? I was like, I'd rather just roll the dice than have healthcare because of what it was cost, not understanding. I think people just don't understand deductibles. They're not able to understand and navigate this.
No, it's like I've said in previous podcasts, is this should be taught in high school. This should be a subject in high school: how to buy insurance, from your car insurance to your health, to how to invest, and they do a shitty job in this country because they're too caught up in woke politics versus reality. Just my opinion, of course.
Hey, but you can have that opinion. It's your show. But I love that one. And we're going to talk about sharing a success story. Could you share a success story of a solopreneur who saved significantly using ClaimLinx Concierge Service? One was me, and we've already talked about it on the podcast, but I can just say what Tom was able to do is guide me through this so simply. And when I first saw this is what he was choosing, I almost said, are you crazy? This is my literal term. I'm thinking, are you crazy? I'm not going to pay this deductible. And he's explaining, that's a tax write-off, Neil. Oh, okay.
Not only that, you could qualify for grants or negotiate it so you don't ever pay that. If you tell the hospital, hey, will you accept this payment in full? They go, it's a $5,000 bill, $4,000. Great, you just knocked 20% off your bill right there.
And it's a tax write-off. So the point is, when you choose these decisions, and this is the thing, you look at these things, and then when I saw the deductible, Tom, I was scared, not knowing, oh yeah, but that's not for everything. Still, you'll get to see your doctor every year. You'll get to do this and that. And I said, if I would have bought the silver plan, which I did years ago, I'd say to myself, are you kidding me? And I'm paying this much.
You still have the same out of pocket on the plan. It's just that you get there differently. It might go 80-20 or 70-30 after you hit your deductible. No one understands co-insurance. And here's why they don't. If I'm driving my car and somebody rear ends me, first of all, I don't pay any. Let's say I rear end somebody else. I was checking out my text message and boom, I hit somebody. I have a deductible to fix my car. Let's say it's $1,000. I know after $1,000, I pay no more. That's not how health insurance works on a lot of these plans. They have something called co-insurance. No one understands any of it. And I just sit there and I'm like, no one understands their car either. With the mumble jumble, all they know is if I hit somebody, I have insurance. If they get hurt, my insurance pays some of it, most of it. But most people don't understand it. So then a lot of people are going out for the best price. I don't know what the hell they're buying. So, okay, it'd be like going out and they give you a You're buying a car and you want the best price. So they give you a 2000 Subaru that's rusted in the bottom of the last 2 months, but you get to pay $200 instead of 300.
Exactly.
It's just the way it works.
And basically, after I saw all this, I'm like, this is crazy.
No one understands it.
Because here's the problem with the Affordable Care Act. You're going into a marketplace where you have no experience on the health side at all, none. And you only have a certain amount of time if you're a solopreneur or an entrepreneur, like a gig economy, that I'm not wasting time. When you work for somebody, sure, right, you can take that time to get on the desktop and put that. No, I don't have that time. And you're looking at these numbers and you're like, and I only have till this time to do it. It becomes overwhelming.
No one understands the rules. Like I was golfing the other day and my guy I was golfing with, he's quit his job and he gets to the end of the July, he gets health insurance. So today, August 1st, he thought he had to do COBRA. I go, no, you have 2 months to make a decision. So you wait the 2 months. If something major happens, you buy the COBRA on the person it happened to. You don't need to buy the whole family. And then you get a plan October 1st. So within the timeline of the law, you get no pre-existing health plans. And he's sitting there going, oh, that's a great idea. I'm like, okay, how much is COBRA going to be? $2,300 a month? And I'm like,
and people will do it just because they're fearful of what can happen.
I have another one. They get off on August 31st and their premium, because they qualified for subsidies for the rest of the year, they're going to be like $280. And their kid isn't on their tax return and he has his own company and he gets 100% health plan because he qualifies for both the silver and the subsidies because he makes that. Doesn't show much because he's just starting a new biz. And then you get these poor people who are sitting at a job hating it because the younger whippersnappers have come in and they're ready to retire and they think they have to stay because of the health insurance. And I'm sitting there going, no. In fact, you can get it for no cost if you do it right.
See, if I would have known Tom, my life would be different. Now I do. Now he's introduced me to people that's changed my life. That's why you have to go to ClaimLinx.com, because Tom's going to change your life. It's truly true, because what you know and your series, the experts you have on your team in any area of financials really can change the game. And that's why I recommend anyone who's a solopreneur. I'm glad to know that's an initiative, because basically, hey, are you happy with your health insurance payment right now? And you're just paying out of pocket. Because there's so many business owners out there, Tom, that are self-employed and they literally don't think they can afford health insurance. So they just don't even pay at all. And then they take a chance and something serious happens to them and they go bankrupt. Stories are endless in this.
Yeah, it's in the saddest part of a lot of people who aren't showing much income is they can get, even without health insurance, get the grant to cover the whole thing. But the hospitals don't come and tell you that you can pay nothing because that's not their job. It's research. The other thing that I feel bad for people who are starting their own business who pay federal taxes with all the games that are available because of Inflation Reduction Acts, Big Beautiful Bill, and other things they just are unaware of. It's crazy.
And how simple is the process for a self-employed individual to start working with ClaimLinx Concierge Service?
Pick up the call. You might have to fill out a form. We charge $110 for consulting fee, and you're on your way.
And the average savings for a person as an individual could be thousands of dollars or more, which when can you save thousands of dollars on anything?
I don't know. Geico gets a lot of people because what they say, they save 15 to 20% on your car insurance.
But they don't give you good car insurance then. I'm going to say you never know, but ClaimLinx is top notch. That's the difference, Tom.
We're using the same carriers that you're used to. Yeah,
exactly.
It's
the game of life, Tom, and you're able to teach people that. And we talked about that marketplace. What would you say when you get to the marketplace, if you try to do it by yourself, how much time does it take people to really figure out savings? A long time compared to that one call. What is that worth to you as an entrepreneur? I know for a fact, missing a sales call or missing something, it's worth a lot to have to sit down and try to navigate things on a computer and figure out what the heck to do.
Yeah, if you set it up right, you use your credit card so you get the miles so you can fly to Scotland and other places at no cost.
Tom, all the different things. So that's why everyone should go to ClaimLinx.com and appreciate it, Tom, and we will talk soon. That was the special simulcast of the Neil Haley Show on the Cutting Edge Benefits podcast, guys.